think about reducing any unnecessary effort in the left leg, around the left hip, the left side of the pelvis. And what you'll find is when you do it that way, when you reduce your effort, the left leg will start rolling out to the side to some extent. Good. And then when the pelvis comes back down, just pause a moment. So at any point when you do these lessons, if you get fatigued or you feel like your mind is wandering or you feel like you need a break, just go ahead and take a pause and then continue when you're ready. Now go back to the movement of rolling your pelvis to the left. That's it. And now notice what happens through your back. Can you sense the way the right side of your low back and the right side of your ribs come away from the floor? It's almost like they're peeling up away from the floor. Can you sense the way your weight, the weight of your upper back, pours more to the left side? What happens with your left arm? Does your left arm lie still, or does it feel like the left arm gets a little bit longer or a little bit shorter? And leave that and go back to your resting position. So bring your arm down gently, lengthen your leg, or you rest with both knees bent. Go back to sensing your contact with the floor. So bring your attention to sensing your low back and your pelvis. And sense the right side of your low back and your pelvis and your whole right leg compared to the left side. Do you feel a difference between the two sides that wasn't there before? So it's common that people will feel more change behind the side that we've been working with. So you may notice the right leg feels longer, the right side of the back may be lying closer to the floor. Now please bend your right knee again, straighten the left leg, bring your left arm back above your head. That's it. Now, this time, begin to do a very gentle movement of elongating your left arm, as if you want to reach for something just beyond your hand. That's it. So you start, the arm is more or less straight when you start, right? The elbow's not locked, but the arm is pretty much straight. That's it. So it's just a slight reaching sensation. It's almost as if somebody is holding your hand and pulling your arm for you. Right? That's it. And notice what happens in your left shoulder when you do this reaching movement, and make sure you're doing just what's easy. It's a very gentle movement. You pause between each time you do it. And this movement is so small that it might not even be visible to somebody watching. That's it. Pause a moment. Now let's put the last two movements together. So go back to the movement of rolling your pelvis to the left, and as you do so, elongate the left arm. So do the reaching movement of your arm. And as the pelvis comes back to the floor, the arm comes back, and you pause, you completely let go between each movement. And continue. Does it feel like the movement of the pelvis helps the reaching movement of your arm? Very nice. What does your head do? Does your head stay still, or does it move in any way? And then leave that and bring your arm down gently. Go back to your resting position. And now pay attention to the contact that your shoulders and arms make with the floor. Can you tell which shoulder and arm you've been working with? by studying the contact with the floor. So in other words, has the contact of one shoulder and arm changed more than the other? So generally, as we go through these lessons and you learn to coordinate your movements so that you use less muscular effort, you'll find that the muscles begin to release and lengthen and your contact with the floor changes. So usually people will have a sense of more contact with the floor as if their body is wide.